Welcome to our second video blog documenting our journey in implementing the national standard in-house at the Canadian Mental Health Association in Calgary. I'm Morgan, the manager of the Workplace Mental Health Program and lead for implementing the standard here. So last week we focused on how to engage senior leadership and also how to create a policy statement or a commitment statement. This week, we're really focusing on the gap analysis portion. And so really our journey has been over the course of the last 4 weeks with the gap analysis, and we're still going through it. So it takes a little bit more time than I initially allocated. And I started out thinking I could use the sample audit tool, which can be found as an appendice in the back of the standard. I quickly realized upon review that really what this is for is to document our journey or our experience in implementing the national standard. So where are we within each of the stages? It's not really a tool to assess how psychologically safe and healthy our workplace currently is and where we want to get to. So what I did is I researched various gap analysis tools online, found a format that worked for me, made sense intuitively, and then created my own using Excel. So what I did in terms of the column titles along the top is I broke it down by our goal state, so where we want to get to, our current state, where the deficits are, and then our action items. Along the rows, I broke it up by each of the 13 factors identified in the standard that need to be focused on. Within each of those factors, I looked at what we're doing from the hiring and recruiting process to the termination process. And so how are we ensuring psychological health and safety from the time we meet someone, the time we hire them, to the time that they leave the organization, either through resignation or termination. So I have gone through and looked at our current policy and procedure manual and our employee satisfaction survey that we conducted a year ago, and sort of started to fill in some of the current state. I've identified where we want to be within each of those factors, and I've taken a look at where we currently are using those two tools that I mentioned. And to complement what I've already done, I'm going to be conducting one-on-one in-person interviews with all of the program managers. So I believe we have about 10 to 11 program managers, and I'm going to sit down with each of them, spend some time asking some questions that I identified already, looking at policy and procedure and satisfaction survey results. And then I'm also going to conduct random sample interviews or a random sample of interviews with frontline staff. So what I will do is synthesize both the quantitative information and also the qualitative data collected through these one-on-one interviews, put it into the gap analysis document, look for where we currently are, look for where those deficits are, identify action items of how we're going to move from our current state to our goal state, and then identify really critical areas that we want to focus on first. And believe me, this is a process. And as I said at the outset of this video blog, it's taken longer than I've allocated. So make sure you give yourself enough time while doing this, because you've got to establish meetings with those managers, you've got to build awareness, you've got to gain trust of the people that you're working with to collect this information. So thank you so much for tuning in. I realize it's a lot of information in a very short period of time, but we hope that the written material, in addition to this post, is helpful, and that sample gap analysis tool also provides some guidance and help. Thanks very much.